I coined the term. I sort of invented it now about 15 years ago in an article in the New England Journal. And what it is really is it reflects a major change in the organization of American hospital care. In the old days in the U.S., if you were a sick patient and came to the hospital, the expectation would have been that your primary care doctor would have been in charge of your hospital care. That might have worked 30 years ago when patients who were in the hospital weren't that sick and the pace was pretty slow. It just doesn't work anymore today. The doctor in the office is extraordinarily busy. Having groups of physicians who are really invested in making the system work better, not just in caring for their individual patients. Since the time I coined the term, this has become the fastest growing specialty in American medical history. There are about 30 and 35,000 hospitalists now. At my own 600-bed hospital, I have 50 hospitals that work for me. It's a natural alliance with hospital leaders and managers, and they work very, very well together. Conceptions, I think, are mostly correct. I think that one of the things we've learned in the last 20 or 30 years is despite having an amazing workforce, the care we provide is not as safe or as high quality or as satisfying as it should be. Not only not as good as it should be, but too damn expensive. We have to train new ways of thinking. I mean, the great doctor of the future is going to look very different than the great doctor of the past. You know, he or she may be, I hope, is still very smart and a very good diagnostician, but won't look like, you know, House MD. It's someone who's going to be a team player who understands the role of the system, the importance of checklists and information technology, and teamwork and culture. And so I think patients have some appreciation that American healthcare can do better and should do better, but I think sometimes their diagnosis is not correct. They think that if we just had better people doing these things, and I think that's not the answer. The answer is the system. Is it required that they have a clinical background? No, but it helps. Is it required that I have a business background? Maybe not a background, but they certainly need to understand money and business. I think probably unlike the administrators of the past, they've got to really understand IT and data. They have to understand the political context and the dimensions of the politics. They need to have a background in quality and safety that not only did they not have it 10 years ago, but it didn't exist. I think I have to read a lot, and the literature in the business world about disruptive innovation and complex organizations and how they improve. Thinking about a healthcare administrator 5 years ago, it probably wasn't all that important to understand social media. You have to today. I mean, that's where your patients are. If you want to have a business presence, a marketing presence, you're going to have to be there. You need to really understand the context of the people you're dealing with and the political world that you're in and the incentives that you're under. And a lot of that comes from broad reading, broad thinking, being inquisitive. I hope it evolves into a system that delivers the best care at an affordable price, and I don't think we do that today. Despite having a lot of really good people who are very well trained and work very hard, I don't think our system is set up to do that. Clearly, care is going to become more personalized as we learn more about the genes of each individual patient. Right now, a lot of the things we do are pretty sledgehammer. We treat all patients with high blood pressure a certain way and all patients with breast cancer a certain way, and we're going to learn more and more about how different patients react to different treatments. That's also very exciting, but also potentially wildly expensive if we figure out how to do it efficiently. Mostly say thank you for doing this. It's an incredibly noble field for people to get into, healthcare administration. I think it's infinitely interesting, and I think there are things about it that are going to get harder because the money's going to get tighter. But on the other hand, I think we're being pushed to do something we should have been pushed to do a long time ago, which is to, like every business out there, how do you deliver the best product at the lowest cost? And that means that there will be a role for smart, creative administrators who can make a difference in that regard. And it also means that the relationship that administrators and doctors have sometimes had in the past, which has sometimes been adversarial, we won't be able to afford that anymore. We have to work together to figure out how to deliver the best care and do it efficiently. And so I think it's actually a very exciting era to enter this field.